Hey everyone, this is Dr. Adam Brown and my good friend Dr. Laura Zibners, and we have another really exciting episode of Unstable Vitals here today with my good friend Mac Deford. And how do you remember how to pronounce his last name? It's not DeChevy, it's Deford. It's like that's how you remember. But a really fun background with Mac. Mac, just like Laura, was one of my students in class at UNC, and we just connected well after class. Started working with him on his congressional campaign, and Mac is going to talk with us today about several things. One about being a person who's running from Congress, running for Congress, not from Congress, but running for Congress. That's number one. Number two, talking about running for Congress in South Carolina, but why it is important that politicians and policymakers are so connected into the things that are happening in healthcare, because as we all know, so much of the issues that are happening in healthcare today are affected by policy and policy decisions and what's happening up or not happening up on Capitol Hill. So, Mac, we are so excited to see you today.
Yay, welcome,
It's
Mac.
great to
We
be here.
forgot our
Yeah, thank
opening
you.
line, though. Welcome to Unstable Vitals. Healthcare is unstable, and so are we.
So are we. I know,
That's
and
not
that's what
meaning
makes it
you,
fun
Mac.
and
You don't have to be
spicy.
unstable, but
Yeah,
Adam and I are highly unstable
Yeah,
individuals.
we are highly
We
you
unstable.
are,
can throw Congress into that bucket.
Well,
well,
that's right.
right,
I mean, yeah, that's pretty
right.
unstable
Government's
too.
unstable. Yeah, there's a lot
The
feeling really
economy,
unstable right now. It's a little
right?
scary. I'm
It
hoping you can
is.
make us feel better. But first, I
Yeah.
have to ask Adam, did you become a professor at UNC so that you could make friends? Did you not have enough friends?
Well, I had no friends, and so
None.
so
That's what I
what
thought.
I did was I held the power of the grade.
Hmm.
Like be my
Hmm.
friend, get a
Hmm.
passing score. That's how it works.
Hmm.
That's the quid pro quo.
I mean, the
It's
world's
kind of like
transactional. I totally get that. That's fine.
yeah, yeah. That's how it
Yeah.
happened.
My
I mean,
monthly
like,
check though
well,
was late. My retainer did the payment didn't come through.
Uh, okay, we'll have to work on that. That's clearly a banking error.
Check with
And
your
really, the
accountant.
only reason I like you, Laura, is because of Rob. And the only reason I like you, Mac, is because of your wife, Caroline, your two dogs. And
Well, you know what?
Willie's
I just
pretty
had a
cute
great
too.
time with
So,
Steve in Vegas. So back
oh,
at ya.
that's right. So, you know, it's transactional, but there's other kind of parties at play here. So,
Right. It's good transactions. Anyway, hi
it
Matt.
is.
Hi, great to be here.
Yeah, Mac, where are you coming to us from today?
I am in Mount Pleasant, South Carolina, just over the bridge from Charleston.
Yeah, is it pleasant? Does it live up
It
to its
is, except it's a little gloomy outside today. So,
Okay, okay. So, Mac,
Love
you
Charleston.
are, introduce yourself. I mean, I've talked a little bit, but yeah, tell us a little bit about your background, why you're running for office. Give us your background.
yeah. Well, as you said, Mac Deford, and you used, if you're going to steal my dad jokes, you should get prior written consent.
I know, I know.
But we can deal with that offline. But yeah, I'm running in South Carolina's first congressional district, which here in South Carolina, of the 7 congressional seats, we only have 1 Democratic seat, and so I am a Democrat, and this is really the most competitive congressional seat in the state. This seat flipped in 2018. A Democrat won it, only to lose it to Nancy Mace in 2020. And so we have a real opportunity to flip this seat here next year. Um, but I'm a U.S. Coast Guard veteran. I'm a father of about a year now. My son just turned 1. Husband and attorney. So I've spent a good portion of my legal career in local government. So working on a whole host of local policies, but where I really got to understand the interplay between the state and the federal government and how that impacts your local communities. And so I've worked on projects ranging from affordable housing in what I would consider a more conservative area um, to public health initiatives. When I joined the town of Mount Pleasant as the deputy town attorney at the height of COVID. So helping public officials grapple with a global pandemic and environmental protections and whatnot. So you get to do and touch a lot of different policy areas in local government. And I'm running for Congress. I mean, it's not hard to see that we have a Congress currently, even if you just remove the partisan lens, the Congress as a body is totally ineffective. They've had one major piece of legislation that has been passed under this 119th Congress. And I think we need more public service up there in Washington. We see a whole lot of self-promotion. We see a lot of rhetoric that doesn't really serve the best interest of the American people or our country. And, you know, I just want to be somebody who can go up there, not looking to get more likes on social media, but looking to get good policy through that helps our people.
Yeah, I mean, I think that's a really important piece here is the public service aspect of things. I mean, and let's be honest, the person who currently sits in that seat has had numerous news reports about her conviction of just getting the likes, getting promoted, get promotional activities through the news, and having all of these other type of people that are trying to amplify her, to say things that are shocking at times just to get more likes, or rage baiting people, etc. When you are looking though at coming into Congress, it takes a lot of conviction and a lot of time. And having worked with you before, I know, at least peripherally, the amount of work that it takes. So it's not easy. It takes a lot of conviction. So why though are you saying, like, I need to be a part of this? Like, why are you saying I want to be a part of that instability and chaos?
Yeah, well, so you touched on it. This isn't my first time running. I ran last cycle in the Democratic primary, where you were involved in that. And we were outraised and outspent in the primary 2-1 and came up about 600 votes short against a candidate who had a lot more name ID than I did at the time. And there are no second place trophies in politics, but that was really a testament to the work that we put in and to the ground game, just always being out there in the community and doing it the old-fashioned way. After my loss last year, I tried to convince myself, and coming into this year with this administration, I tried to give myself every reason not to run again. But in fact, everything that we see unfolding almost by the hour only refuted every reason I tried to give myself not to jump back into this. And so I don't see a scenario right now where we can afford to sit on the sidelines. Not everyone is going to run for Congress, just as not everyone is going to go to be a physician. Not everyone is going to, you need people who are doing things in all the different areas, whether it's on policy or actually out there in the community helping people. This is something that I happen to feel that I would do a much better job than our current representative. And I just think that we can't set aside.
Because there's so much you've just said that I want to unpack. Let's go back to the social media thing, because I think the reality is that is how people are reaching and getting more voice and getting attention and bringing in, engaging younger, in particular, voters. But I think what you said, there's a real difference between having a platform that engages and meets voters where they are and rage baiting. And when you said that, it makes me think of, there can't be a person who's not really sad when they saw the East Wing just get knocked down, right? I don't care what party you're from. So can you kind of speak to that? Like, what are people really saying and really feeling? Because we're all feeling just so polarized. I mean, I know that's like the word of the day, but aren't most people actually more like in the middle?
I would say so. And I can only speak for the district here in coastal South Carolina. But I announced my candidacy in August of this year, and I'm the only candidate in this race who's been having public town halls. And we're actually getting a lot of folks from across the political spectrum, even people that voted for Donald Trump as last year. And so I do think that people are feeling demoralized. They're feeling like we are slipping into a direction that perhaps they didn't think that maybe this administration would actually execute So yeah, whether it's dismantling, a symbolic gesture of actually physically dismantling the White House, or just disregarding the rule of law, blowing boats out of the water with no legal justification, ignoring due process, deploying the military on our streets. I think that this is a shock to a lot of people. Maybe not so much for those communities that haven't been directly impacted by it, but here in South Carolina, we have been impacted by it. We're seeing it with the closure of rural hospitals already here in the 1st District. We're seeing it with, we've got one of the largest ports in the United States here in Charleston, and we're seeing an impact with reduced volume in cargo traffic coming through our ports. We've got a lot of industry here, both small business and big corporations like Boeing and Volvo, and they're all taking a hit. So I do think that people are starting to wake up and realize that while they may have rightfully so been frustrated with the status quo, that this is a dangerous direction we're headed in.
This podcast is supposed to be funny.
Yeah. And it's like,
And
but
it's
these are
like
real
really
issues.
not
I'll,
right now.
I'll say one thing. Usually the town halls, I try to let the audience sort of dictate where we're going to go and what conversations we're going to have. And yeah, sometimes I leave a town hall feeling mighty depressed. But what gives me hope is that we've got so many people coming out to them, and they're not just people who are Democrats. They are Republicans. They are people who don't affiliate with any party. So there is, I think, a good indication that people are taking note and stock of where our country is right now.
One of the things, and then I'll let Adam get a word in edgewise, but I was going to say, I want to see at your next town hall, like everybody gets a Hawaiian lei or something just to lighten the mood. Because
That's a good point, yeah.
I wish I was the genius who had thought of dressing up like in a banana costume when, during these protests. I love the idea that there's this silliness to make the whole, to make it not serious so that nobody can punch a banana in the face. Right. And so I want to see your next town hall be like dolphins and palm trees and Mai Tais and leis.
I'm sure that you could get an invite, Laura, and you could come as an octopus. Just playing off a recent talk that you gave, Laura.
I got my octopus is in the closet. That's the sentence I never knew I was going to say. My octopus is in the closet.
Yes. Ooh. So many thoughts.
Can I explain
Bring it
that?
out.
I was just on a panel. Love, can you go get my octopus? I can't get up and get my octopus. I was just on a panel called Women Are Not Octopuses in Vegas. And so I had 2 octopuses wearing little calla lily t-shirts from my company. And then they've traveled with me all the way from Vegas to Sacramento to San Francisco to JFK. And they don't really fit in my suitcase because they're big. So I've been carrying around this tote bag with 2 octopuses, one's head sticking out and one's arm sticking out.
That is
My
amazing.
octopuses are in the closet.
Just as an aside, I mean, you could be like the traveling gnome, the Travelocity traveling gnome of days gone by, but just be like, the octopus is kind of like your traveling calla lily.
That's right. Anyway, back to politics. That was a light moment.
So,
Thank you for that.
Yeah. So, Mac, here's a thing that I think is important. So, if you look at South Carolina's healthcare system, it is one of the worst healthcare. I won't necessarily say system, but the outcomes are some of the worst. One of the highest maternal mortality rates, poor access to health care, death rates are higher. So there's a lot of issues, of course, in the state of South Carolina. And so really a 2-part question: why do you think that's the case? And then number 2, the obvious kind of next lead on is like, well, what do you do to fix it? So kind of like, what do you think are some of the major issues that you're seeing, especially when you talk with constituents? But what are some of the outcomes that are so bad in the state of South Carolina?
Well, South Carolina, first and foremost, I mean, the coastal areas, and then you've got some other urban areas like up in Columbia and Greenville, but the rest of the state is very rural, very poor. So, South Carolina is one of the biggest welfare recipients of federal funds. Because of its financial standing. So I think that has a part to play in it. But I also think, the Republican Party in South Carolina has been in power for over 30 years. But we're also a state that refused to expand Medicaid. And that would have added about 300,000 people would have access to Medicaid who otherwise don't. Currently over 26% of South Carolinians are enrolled in Medicaid, and we've got a poverty rate that's fairly high at nearly 10%. Most of that comes from females that are between the ages of 55 and 64, so coming up on being able to draw from Social Security, which itself is being rated. But I think that we've got a lack of infrastructure in most parts of the state, and I'm not so much talking about the urban areas, but that doesn't allow for people to access quality health care, whether that's they don't have the transportation to get there, or the facilities simply don't exist, or they don't have access to Medicaid and they're paying way too much and can't afford health insurance. I would also say that, this problem is not unique to just the rural areas, but I served as general counsel for the town of Hilton Head Island, which is a relatively affluent area, and I would say conservative, but they've got one hospital on the island, and it is such an issue with staffing there because people can't afford to live on the island and they can't keep staff at that hospital, that there are some days where if you come to the hospital via ambulance, a triage nurse will come out there and triage you in the ambulance. And so if you are not life-threatening, they'll send you off island because they don't have the bed space. And so that's a huge problem that impacts with regards to staffing at our medical facilities that we definitely struggle with here in our state.
I used to go on holiday when I was a kid to Hilton Head, and it's a lovely place, but it's snail mail pale heart attacks on the golf course and alligator attacks. Like, those seem pretty serious to me. We should have a hospital that functions.
Hmm. Mac, you brought up so many different, I think, important issues right there. It's like, number one, you mentioned, okay, lack of access to healthcare because of a lack of expanding Medicaid. That's one. And the party in power in South Carolina has refused to do that, and they've been in power for well over 30 years. That's one. And of course, Medicaid, as we know, helps support a lot of women and children. It supports, it's like half of the female population, or half of children are on Medicaid. So, like, you're talking about big portions of the population that don't have access to healthcare because they don't have insurance. So that's one. Then you brought up the issue about just transportation. So the ability to get from one place to another, if you don't have a local hospital or roads are congested, that all adds to the complexity. The third, you said affordable housing. I've been to Hilton Head as well. Laura, you've been down there. It's an expensive area to live, but it's absolutely exploded in population all across this kind of eastern seaboard of South Carolina. And there's no affordable housing, therefore people can't live there. So getting access to even having doctors and nurses at the hospital becomes more challenging, much less patients being able to work where they live or live where they work and then get to healthcare facilities are even more of an issue. These are all tied together in kind of a social determinant and really a political determinant of health. Would you agree?
Yeah, absolutely. So when I was general counsel for the town of Hilton Head, they decided that they were going to be in the business of workforce housing, which is pretty rare for a municipality or a local government to really take that on, especially when they don't have the technical expertise for it, and especially for a municipality in South Carolina. So there was a lot of education around that because there was a lot of opposition at first, where the public automatically jumped to, well, we don't want Section 8 housing on Hilton Head Island. And so there was a huge public relations campaign to educate the public to say, no, this is not Section 8 housing, but we have a crisis, and there is a problem when your one hospital on the island cannot service you. There's a problem when you have to go, drive to Savannah, for example, to go to your primary care physician because there aren't enough primary care providers on the island that can meet the population's needs. Same goes for teachers and firefighters and police officers and whatnot. But so there's a huge educational component, but we were able to actually have that conversation with the public. And by the end, of it, we had members of the public showing up to town hall meetings demanding why it wasn't being done quicker. And so it was really rewarding to see the shift in public sentiment from rejecting it outright to actually getting frustrated with the local government for not going about it quicker. And so in this particular case, what we were able to do is take a piece of town-owned land, about 12 acres, and put out a request for procurement. And we were able to partner with a local, with a developer who actually specializes in affordable housing. And the town will retain ownership of the land, which ensures the affordability of it. And it will be a community. They're going to break ground early next year. But it'll be a place where your workforce can have a place to live. And we're talking about like nice, high-end apartments that will service those healthcare workers, those police officers, teachers, and firefighters. And we're able to get that done in a fairly conservative area. And not to run on about this, but because of that success, now areas up in Charleston, which is the largest metropolitan area in the state, they're looking at doing things just like that in the county of Charleston, and also up in Berkeley County, which is the neighboring county. So we are seeing I would classify it as a bipartisan effort to address this issue, and I think that it does have a direct impact on healthcare. Because if people, if your appointments are, 60, 90 days out because there's no, of a lack of staffing, that's a problem because you don't have enough people that are able to work in those communities.
Hey, can I follow up just really quick on that? The one thing, Mac, you just talked about, just to paint a picture, because a lot of people don't know Hilton Head and don't know. So I remember from before, and correct me if I'm wrong, a lot of people that worked on Hilton Head or worked in Charleston were having to have an hour commute time to try to get in, or 45-minute commute time. Is that accurate? I just want to make sure I'm...
Yeah. I mean, a lot of people who work for the town do not live on the island.
Yeah, so like you take, for example, people living 45 minutes to an hour plus away, you multiply that by 2, going to and from work, you multiply that by 5, you're talking about a day plus out of the week, essentially, that you're commuting in the car, not able to spend time with your family, not able to be at your kid's baseball game, or help your kid with homework, or go to doctor's appointments, or provide social care or family care, or any of those kind of those things, and those affect health. And I think I think one of the big kind of takeaways that I took from being down there with you, but also just knowing the area, is that if you're having to commute an hour into work, it also, if the jobs are not that high paying, depending on what type of jobs they are, it's the level and the burden that is on a family is really quite high, because a lot of the rural communities don't have any jobs, so it's a real challenge to have to address.
But I think what I'm hearing is, okay, there just seems to be a lack of compassion in the world. So we can't be asking people to just be compassionate. Oh, that sucks that you have to travel so much, right? I can just hear people that I know in my life going, tough shit, right?
Mm-hmm.
But maybe the answer is exactly what you just described, is when it starts to touch individuals, people care more about themselves these days than they do about the greater good. So if I, wealthy person with a golf cart, cannot get my alligator attack attended to in a timely manner, that's when it starts to shift. I start to understand, and I was also thinking, the other thing that I'd love for you to speak on is people don't understand how many different factors are at play. So like when I was a little doctor, I had a Friday afternoon continuity clinic, and I would get so annoyed because no one ever showed up. And I'm like, why can't these parents come in? And then one of my attendings was like, you realize that the welfare check comes on Friday, and if they're not home, it gets stolen out of their mailbox. And I was like, oh, right. That didn't occur to me. That's why their kid can't come to the pediatrician. So I think that that's a real, a lack of understanding of the so many factors that are at play here for people.
Yeah, I mean, none of these issues exist in silos, and that's why I think you can't have a serious conversation about reforming healthcare in the United States without touching on a whole host of other issues, from childcare to even education, infrastructure. I mean, do people have transportation to get there? Are the roads going to facilitate their movement to where they need to go? And the answer in South Carolina and a lot of places is no. And so that is an issue. But you do bring up an interesting point, Laura. Is there does seem to be a lack of compassion, and I'd be lying if I said on Hilton Head, for example, I think if you were to poll the population, a lot of people were concerned about they're living in a resort community, and so if people can't work in those hospitality jobs, the level of service declines, and there's obviously a concern about emergency services, not having firefighters to be able to respond to emergencies and medics and whatnot. But it does kind of touch on the framework that I make for healthcare reform and really for everyone in the United States to have access to quality, affordable healthcare. And so I do believe that there is a moral imperative. That's the first argument I would make. That we are the United States, the strongest country in the world, and I think that in large part we should be measured on that in that status based on how we treat people. Do we care? Do we have a society that cares for its people? And if not, I don't think we're a very just country. So I do think there's a moral imperative, but I know that there are some people who may not buy that, and they say, well, we're all got to bootstrap ourselves and do it on our own, which I think is an entirely different conversation. But I also think that there's an economic imperative. I mean, there is a cost to doing nothing. We spend over $4.5 trillion a year on healthcare, more than any other country. 18% of our GDP, and yet our health outcomes do not correlate with that level of spending. And so, we've got a lot of inefficiencies in this sort of profit-driven system that's just riddled with administrative waste and whatnot. And with that economic imperative, I would say, if we have unhealthy workers, that means we have an unproductive economy. It means less people that are able to engage in our economy. And then the last argument I would make is there is a national security imperative. If we have, a significant population, percentage of our population of military age, they are not fit for military service. So if we do not have people, a healthy population to draw from in terms of military recruitment, that is a big national security problem. Mm-hmm. Or people that can work in the workforce in that space that are designing the next generation fighter aircraft and naval ships.
Yeah, go ahead, Laura.
I was just going to say, I'm taken back to what you said at the beginning of this conversation about the group of women that would have been eligible for Medicaid had been expanded. Precisely to your point, there is a real impact to the economy when women entering menopause aren't given access to hormone replacement and other therapies that then avert the frailty that women live, the last 25% of their life in, unable to work because they've got broken hips and they're frail and they have sarcopenia and all these things, right? And so I think it's something that people don't realize, just the impact on the economy of not having a healthy population.
Mm. Yeah, I mean, I think that's an amazing point, because I think that people oftentimes don't make that connection that not only are we paying $4.5 trillion, 18% of the GDP, we are also getting, 3 to 4 years less than our counterparts in the UK and France and Germany. That's one. Number two, we also have productivity issues. Why? Because our population either dies early or they have more morbidity. So they may not die, but they also are not as productive. Why? Because they are sicker or more frail. And Laura, to your point, which I think is an excellent one, is that if women don't have access to health care, health insurance, if we're capping the amount of people who can have Medicaid, or it's becoming more expensive. I saw this quote today that's $27,000 on average for a family to have private insurance, healthcare insurance. That is just insane. So they're making a lot of trade-offs between what type of insurance they get, what's covered, what's not. Then you're taking women who would be productive for another 10, 15 years postmenopausal, who have higher issues with joint and bone disease that they would not have if they'd been on hormone replacement. So they're all interconnected. I mean, it's really, really, this is the whole idea of like desegmenting or saying like, oh, social determinants of health is bullshit or political determinants of health is bullshit. No, they're all connected together. And it really is determinative of how long people live and how healthy people live. Hey, Mac, I wanted to ask you, so you talked about how like in Mount Pleasant, or Hilton Head, that there was an initiative to recognize, okay, we need some type of affordable housing solution, and that which is not traditionally a more conservative or rightward or Republican type of ideal. It tends to be more Democratic or left leaning. So, but you got it through in a fairly Republican area. So, what did you do? Like, how did you make that argument? How did you get the people engaged? Because I think it's something we started with in this initial conversation is a lot of people, once you start talking with them, are more in the middle than they are on the edges. And so, like, how did you kind of engage that population? What were some of the tactics that you guys had?
You used Hawaiian Lays.
Yeah,
Yes. We had to get them there to the town council meeting somehow.
yeah,
You know, so yeah, I mean, a lot of people were initially against it, and I mean, you know, again, I was the general counsel, so I was the chief legal officer for the town, and so my job was really to formulate the structure, but also to advise, you know, council whenever they would ask, or council members of, you know, if they wanted my thoughts on how they could potentially message something, and I generally reviewed all of that to make sure that we weren't, you know, releasing anything that was privilege. But you know, it really was an educational process. The town of Hilton Head Island has a lot of retirees, a lot of people who've done really well for themselves. So they're actually very involved, and they know what's going on in their town government, which is helpful. So we did have a lot of community participation. Like I said at first, rejecting the project, but then they came around to being staunch supporters of it. So a lot of it was educating them on what it wasn't, right? On what this workforce housing project was not. That it was not Section 8 housing, that this isn't going to be what you would think of when you think of the traditional government projects of, you know, the 1970s, the brick, you know, military barracks looking type structures. That no, this is actually going to be a quality project, and it's going to have a developer involved in it from the private sector who knows what they're doing, that has been successful in other areas. So council members actually went down to Atlanta, where this developer is headquartered, and got to tour you know, communities that they had built down there. We also put together a citizens task force to include members from the community that have different backgrounds. So I think we had a banker on that committee, we had a developer on that committee, I believe we had a healthcare professional. So we took people from the community and put them on there with different backgrounds so that we could solicit their advice and thoughts on things, but also so we could communicate through them and help get word out that way. So we were really successful in that. And to kind of go back to what, you know, I think with the role of government, you know, I think we always get distorted on, okay, well, what exactly is the role of government, you know, and do we support a free market? I would argue that this administration does not, when it's buying up significant stakes of U.S. companies and threatening them and molding them to their will. But I think it's the role of government, undoubtedly, to fill in the gaps or at least pick up the slack when the private sector falls short. So for housing, for example, there is a housing crisis all around the country. And it's very significant here in the district that I'm seeking to represent. And so I do think it's the role of government. We're starting to see these local governments come together to come up with viable solutions that are actually going to make a difference in people's lives and strengthen our communities, not weaken them.
You know, it's funny you're talking about all these different things. So one key theme is engagement. That's what we're hearing. But how to engage is through really pulling together stakeholders, even from different political parties and political ideas. And, I got to think something that's happened over the last several weeks is listening to Marjorie Taylor Greene talk about which is not something that I would have had on my bingo card to be like, oh my
When
gosh, what
Marjorie
does
Taylor
Marjorie Taylor
Greene and
Greene say?
Hakeem Jeffries are agreeing, the
Agreeing, it's
world,
like,
like I'm living in a, yeah.
yeah,
2025 has been a year of firsts.
yeah, but she's from a rural area of like northwestern Georgia. She's talking about the issues that are real to people right now. I mean, I don't want to praise what she's talking
No,
about,
no,
but
no, no.
when it comes to like she's saying, hey, health insurance is extremely high. Auto, home insurance, housing prices are high, food prices are high. We're about to get walloped with all these premiums. Those things she are saying. I mean, broken clock, but those things are correct. But it does seem to me that those are issues that constituents, that people are dealing with, and there's likely to be some common ground that could be forged. Not necessarily with her, but maybe, who knows? But like, could be some common ground forged to try to address some issues because these are really big issues.
Yeah, and I think that there's actually a lot more commonalities that we share as a people than what tears us apart. And unfortunately, I think that there are a lot of folks in Congress who benefit from the divisiveness.
Yeah.
So, the Nancy Mace, who currently represents my district, who's now running for governor, she's taken a strong stance on the bathrooms, and she's attacking transgender individuals left and right. But she's not talking about is healthcare costs. She's not talking about infrastructure. She's not talking about the everyday prices for everyone where we're seeing things go up. And so, yeah, I mean, I think that that's just an incredible disservice, and one of the reasons why I'm running.
Yeah, Mac, do you feel like, so we've talked about like these are a lot of the issues. What would you say? Okay, so Medicaid is a state level decision of expansion, but there's federal connections. But if you were to say what is the number one thing from a state, even though you would not be you'd be representing a portion of the state, but what's a thing on the state level that could be done to improve the health of South Carolina, and then what's something on the federal level that could improve the health of South Carolina or other people around the country?
So on the state level, I think that we should be encouraging more healthcare facilities in our rural parts of the state where people don't have quality access. Also investing more heavily in broadband access so that they could access telehealth services as well. Obviously, expanding Medicaid, I think, needs to happen. And I think that if not, that federally, we should look at ways to work around that so that we could still, provide access to Medicaid to folks who need it when a state is refusing to do so. On the federal level, I mean, and this is where, Adam, when you're talking about, more things that may bring us together, I actually do think that there would be bipartisan support on reforming PBM, pharmacy benefit managers, regulations. I think that it's really indefensible of how PBMs currently operate. And so I do think that there could be a lot of headway that could be made there. It's not maybe as sexy as a topic. A lot of people may not know what PBMs are, but I think that would have a significant impact on costs for medication for folks.
Yeah, it doesn't stand for peanut butter. Peanut butter and
Marshmallow.
Yeah, it doesn't sound like PB&J. It's not peanut butter marshmallow.
Right.
You bring that up, and I think that's the PBM side of things is a really good one. But we just saw with the big beautiful or big bankrupting bill, I think is something you said to me before, Mac, is like the big bankrupting bill. I mean, they cut a huge amount of Medicaid funds, and I mean those are things that I think that when the chickens will come home to roost on that. That a lot of facilities in rural communities are going to start having major issues. I've written about it before. They're operating off of very small margins or negative margins, and this certainly will not help when you're kicking millions of people off the Medicaid rolls. So it's very much I think that's going to be a big issue. But the other issue that you've mentioned is just we don't have focus of Congress right now or the administration on affordable housing, on transportation, on childcare, on these kind of, yes, there are many of them are social issues, but they're social issues that impact the longer term health of the country. I mean, can you just imagine if Eisenhower didn't put in place the interstate system? How crippling that it would be in the country that's very much dependent on cars if we didn't have that system, how challenging that would be, you know? So that's just an example where an idea 70 years ago came about, 75 years ago came about, that has massive implications to economic development and the health of a population just from the interstate system.
But I think that also reaffirmed that particular example reaffirms the notion that you have to do things now if there's going to be a benefit for it later. So we still benefit from that same interstate system. That work was put in back in the 50s, and there is so much that needs to be done now that is not. And you know, at the end of the day, the one big bankrupting bill was terribly unpopular. You know, that's why J.D. Vance had to come in and cast the deciding vote. And that's why Republicans weren't holding town halls, because they would not face their constituents and look them in the eye and tell them that this was a good deal for them. This was a bad deal. This was a deal that really was to provide significant tax cuts for billionaires and corporations on the backs of ordinary Americans and at the expense of their health, among other things. And it really is that simple if you were to distill it. So I do think that this is again, a terribly unpopular bill, and it really hurts the most vulnerable, and it hurts an awfully lot of people here in South Carolina. Many people who voted for this administration.
Oh, this is just the least funny episode we've ever had.
I know, right? Like there's a
I guess I'm gonna go
that's
kill myself. All right.
yeah,
Like,
I know,
yeah.
but here's the thing about unstable, and I mean you and I have dealt with this, Laura, is sometimes when things are unstable, it's not funny. And we've got
It's
to look
really
at it.
not funny what's happening. Like, we're talking about actual human beings dying because of the decisions made by this administration and some of its, like my least favorite human on the planet, Mahaha,
Yeah,
right?
RFK
Like,
Jr.
like children are dying.
Mhm.
And I don't understand. I think you said it earlier. What kind of country prides itself on not treating its citizens with some basic care and compassion? And I had actually never thought of what you said earlier, which is if we have an unhealthy population, who's gonna be our soldiers, right? Like the whole thing about the ice that they're trying to ram through these ice agents, but most of them are less health. They can't run a mile and a half in like 30 minutes or so, whatever it is. Like, who can't run a mile and a half in 20 minutes? Like, right? A turtle can.
Mhm.
So if we don't have a healthy population, how are we supposed to be defending ourselves?
Mhm.
Exactly, and you bringing up RFK Jr. So I really admire his father, Senator
I thought you were
Robert
going
F.
to say you
Kennedy.
admired him, and I was going to be just
No,
like,
no, 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 no,
It's probably
no.
like,
So
what the?
I'm disappointed in the how his son has tarnished his name, since they share the same name. But I think it's really ironic because when RFK Jr. was a kid, his father was a senator, and he went down in the Mississippi Delta because he heard about these children starving with distended stomachs. Didn't believe that it was true until he went down there. When he came back, there's a story where they were all at the dinner table, and Bobby Kennedy was very quiet, and all of a sudden he slammed his fist down on the table and said, you're going to have to do something about this, your generation. And he was visibly upset. And so again, we've lost that sort of compassion in our government, and I think it's really important that we try to get that back, and we elect people who are going to fulfill that loss that
Completely
we
agree.
have.
Well, listen, we've only got about 2 minutes left. Mac, really appreciate the conversation. No, it was not as like comedic, but it is kind of grim. But this is why we elect people, to try to fix some of the problems. So, 2 last questions, Mac. Question 1: wave a magic wand. What's the one thing that you want changed for if you were elected? What's the one major thing that you want to change? And then number two, how do they find you, find out more about you? So question one, magic wand.
Question one, I mean, I'd really like to see a reaffirmance to our Constitution. You know, we are not headed in a dangerous direction. We are in it.
Yep.
Laura, not to add to your distress here.
That old chestnut, the Constitution.
Yeah. So
what? What's that?
Yeah. I mean, I cannot stand anyone who's sitting by and letting this administration get away with what they are, and at the same time they're waving the flag and wrapping themselves in the Constitution. Just don't do it. You know what? Light it on fire, because that'll, at least you're being honest. But I would like to see us, you know, get back to that. I mean, in terms of legislation, I do think healthcare is an incredibly important aspect. But again, it's such a large issue that there's no silver bullet that's ever going to fix it, right? When we talk about gun violence, for example, we always hear the main reforms that could be enacted, which a majority of Americans support, like universal background checks and closing the loophole, red flag laws. But something I don't hear us talking about is social media reform, where we see a lot of young people becoming radicalized. And the whole reason for that is because these social media companies have immunity under the Communications Decency Act that was written in 1996 at a time when the internet was nothing like what it is today. You know, if you could put liability on these companies that are profiting off of this system of hate and pushing vile content to young people and radicalizing them, perhaps you can start to make a dent on lowering gun violence in our country. So I would like to see a greater effort and more seriousness coming from the elected people who represent us at all levels, but especially up there in Congress. And to find out more about the campaign, it's defordforcongress.com. Remember,
not
Deford,
DeChevy,
not DeChevy,
not DeChevy, Deford for Congress.
DEFORD, Deford.
Yeah, but yeah, no, this has been great. So sorry for the somberness of the conversation.
Next time we're going to have you on, and it's going to be Hawaiian leis, and we're going to have Mai Tais, and I'm going to wear an inflatable dolphin suit. Okay.
I think that's great. Or you can just come as like Three's Company. What's that lady's name? A Miss Roper outfit. You know,
you want me to dress like Mrs. Roper?
Yeah, why not? I'd love.
Am I not almost already there?
Okay, good point. That wouldn't be enough of a stretch for you, so you know. But anyway, well, listen.
Okay, Chrissy.
Really
Mac, this has been fun. I mean, not. It's been actually the least.
It's been
fun
well. Adam stole my only joke, which was the DeChevy joke. So
that wasn't even the joke. Like, do you know what the 0 said to the 8? Nice belt. That's a joke.
I think that's decidedly worse. Yeah. And so with that, it's great to have everybody on Unstable Vitals, where clearly one is more unstable than the other, but we both are a little unstable. So, Mac, so good to have you on.
Thank goodness Mac's not unstable. Go save the world, Mac.
Yes,
Go.
please, Mac. And check Mac out at defordforcongress.com. And we really appreciate having you on. And best of luck. All right?
Thank you.
Thanks, everyone. Until next time.
Thanks for tuning in to Unstable Vitals. If you enjoyed this episode, make sure to follow us for more unfiltered conversations on the pulse of healthcare. Connect with us on LinkedIn or visit unstablevitals.com to stay in the loop. And don't forget, real change starts with real talk. See you next time.